In that picture, might look a little gruesome, but actually the majority of what you're seeing is marker, and my skin is crinkled up just from the tape and wearing the compression vest. Alright, hi guys, Nick here. It's been about 2 weeks and 2 days post-op now. A lot of the swelling has gone down. I'm down to just wearing non-stick gauze on my nipples now. I took the tape off my incisions a few days ago, which was a big relief. I had to write some stuff down just so that I kind of stay on track. So, something that I'd like to say about the first week after surgery. The first 3 days, a lot of people say that it was a rough time. For me, I didn't have that bad of a time the first 3 days. It was day 4 that I had a problem with, a big problem. And because I'm making these videos more so for educational purposes, I'm going to go ahead and just be blunt. I was severely constipated. The Colace that I brought was not enough. I highly suggest, if you go through with this procedure, get some laxatives. Just be safe. It's better to have everything covered than to be sitting there and waiting for somebody to go and get the stuff so that you're not in pain anymore. That wasn't fun at all. I'd say that overall, I thought I was going to be in a lot more pain from this whole entire procedure, but I think the most painful thing, honestly, was being constipated. So yeah. Another thing that has been happening is I'm feeling like shots of pain firing off throughout my chest, and that's just the nerve endings reconnecting and stuff, and it can be pretty painful at times, but it's not like deathly curdling pain or anything like that. It's definitely tolerable. It just really catches you off guard. Also, you might experience your face breaking out a little bit from the Percocet or even the morphine or whatever it is that they give you when they actually do the procedure. I'm not used to it in my body, so my face is like breaking out now that I'm not taking it, and kind of a pain, but it is what it is. I am now to the point where I'm just putting Visine or Vaseline on my nipples now, on the nipple grafts, and today I actually had to cut some of the sutures that were on my right nipple just because it hadn't dissolved, even though they're supposed to, and so it was causing a lot of pain because the compression vest and the gauze was just rubbing and irritating it. So I sent a little video to my nurse and she told me to snip that stuff. So that's what I did today. A lot of relief came from that, as well as when I got to take the tape off of all of the incisions. That was a huge relief. And now I don't have to wear like the padding in here anymore. So that's also great too, because the less compression, or just the less tightness, the better. I'm still going to wear the compression vest for another 2 weeks. I only have to wear it for like 1 more week, but I just feel better wearing it for a month in total until I don't have to have the nipples wet anymore. They don't want the nipples to dry out for the first month after the procedure. After the first month, then I get to start massaging the nipples with a moisturizer. And right now I'm using a couple of things on the incisions because I get to massage those, and I'm actually using vitamin E with rosehip and jojoba oil all infused in one, and then also self-heal extract. Just rub those on there 3 times a day and good to go. Let's see. Oh, the first week after my surgery, I thought, because I was feeling pretty good, that I could walk around and sit in a car for like a 4 or 5 hour car ride with a seatbelt over my chest. No, cannot do that. I learned later on that night after I went to bed early and had to unzip my compression vest and just have the two eye holes in clasped, that I was not a very happy camper. I was pretty swollen. I was just in a lot of pain, and it took about 2 days for that to subside, and it just wasn't any fun. Uh, yeah, I think that happened again about 4 or 5 days after I was in the clear once again, and I was able to be up and move about a little longer, but I still kind of swelled up and stuff. But now, 2 weeks and 2 days after surgery, I can sit up for about 5, 6 hours or even stand without having any problems. Um, doesn't mean everybody can do it, but that's just where I'm at right now. Let's see. My arm mobility is halfway back, I'd say. Yeah. I can do more stuff down here. We'll just keep it that way. I'm definitely putting on weight and losing some muscle, but it's a part of the whole entire game, you know? Like, get back to doing stuff later on when I'm all healed, so that's not a big deal. I'm not taking as much ibuprofen as I was taking. I'm probably down to like 6 pills a day. Yesterday I tried to go the whole day without taking ibuprofen. No. That I wasn't too happy later on in the day. So that's definitely something that's still in there. I was taking Benadryl as well up until I'd say two maybe 3 days ago. Just because the vest does get a little itchy sometimes, and it keeps me from moving my arms a bunch and trying to itch a bunch of different places that I can't reach. So yeah, and as far as how I'm feeling, I'm extremely happy with my results. Dr. Medalie did a wonderful job. He's a very fine surgeon. His team, his staff was extremely friendly, answered all of my questions and any questions that I could have come up with eventually. The nurse as well, Mary, she has been great at picking up the phone whenever I call and have a question. They really calmed a lot of my nerves and still have been calming a lot of my nerves. I was worried that I would possibly suffer from a little depression after the surgery, just because that's something that does happen with some people, but I have not found that to be my case. I'm not saying that there's anything wrong if you do suffer from some type of depression. We're humans, and we're entitled to feel however we want to feel, you know? There's no shame in that, but that just wasn't my case, and I've been nothing but happy about everything. My left side, or my right side, did kind of flare up a little bit along the incision. My left side is very flush. It's very nice, but I'm hoping that with the rose hip and all of that, it'll kind of bring down the swelling or the inflammation that's going on in there. Yeah, I'm very, very, very happy. It's just amazing. It's really cool what's going on here, and in a couple of weeks I get to take my first T-shot. So yeah, life's great. Life is amazing. Trying to get curse words out of my vocabulary, so forgive me as I go through this process of eliminating those. I am vegan, so once again, I'm eating a very nutritious and varietized diet. I've been staying away from coffee to the best of my ability, and when I do drink coffee, it is decaf, just because caffeine is another drug. It's a stimulant, and I'm just not introducing anything into my body that is going to just mess with what I have going on here. So with that said, no, I'm not smoking weed. No, I'm not drinking. Yes, surprise. Ooh, I smoke weed and I did drink, but I haven't been doing either of those since about a month before my surgery. And, well, definitely the weed. I had a beer or so, like 5 days before my surgery, but I haven't had anything since. And I will say that being sober and getting to know myself, especially through a big procedure like this, has been a gift, to say the least. It's been amazing. So yeah, big changes and beautiful changes, and I'll see you guys in a couple of weeks. Stay blessed.